So hormonal optimization, I think, is key to look at for recurrent urinary tract infection. The other thing that I've started looking at with my patients is micronutrients, and we do advanced micronutrient testing where we can draw the blood and look at literally dozens of different micronutrients, minerals, and vitamins that we need to allow our cells to function optimally. Hi, I'm Dr. Christi. Welcome to the Christi MD podcast. I am so honored that you are here listening, and I hope you'll get some value out of this podcast. Today, we're going to talk about some advanced treatment options for recurrent urinary tract infections. I'm Dr. Christi Promujida. I'm located in Houston, Texas, and I am the founder of LifeSculpt by Christi MD. I'm also the author of the BioVitality Blueprint, which you can check out on Amazon. And I am a board-certified urologist and urogynecologist. So to say that I've seen UTIs in my career is a huge understatement. I've probably seen it hundreds or thousands of times. I'm sure thousands. And it is such a big problem. And it is something that we're trying to solve and really haven't been able to come across anything that can really quickly cure recurrent urinary tract infections. So I have developed a protocol primarily looking for underlying causes of recurrent urinary tract infection. I use the principles of cellular biology, mitochondria, hormone balancing, and regenerative medicine to really think through what could be causing this patient to continue to struggle with recurrent urinary tract infections. What I have observed over my many years in private practice and seeing so many patients struggle is the patients that don't do well often have underlying health problems. Their overall health is not good and needs to be addressed. And whatever has been attempted with medications as far as treating diabetes, treating their other medical conditions, whatever's going on with their heart and circulation and what is really affecting their overall health hasn't really helped. And they continue to be in a cycle of poor health. So what I've started doing with my patients who are willing and wanting to dig deeper is I have compiled a series of tests where we can look at various markers to see what is going on with that patient, what their underlying issues are. If you think about it, the bladder is made up of various cells. Okay, so every part of the body is made up of cells, and you have to think about what's going on at a cellular level, what's going on in that micro environment of the bladder, and what is going to help the bladder fight off infection. So there are numerous factors involved, but we do know that the bladder, number one, is very sensitive to hormones. So making sure that the bladder is getting the proper hormonal support is very important. And the primary hormone in women is going to be estrogen. The bladder, as well as the vagina, is very sensitive to estrogen. And when the bladder doesn't get fed estrogen, it will tend to atrophy. It won't function as well. The cells won't have as good of blood supply, so they can't clear the infection as well. In order for the immune system to work on an area, you have to have good blood flow to that area. And you have to, because the white blood cells need to come in there, the antibodies need to be able to get in there and really clean that area up and then take away the waste products, take away the inflammation. And so when there isn't good blood flow to that area, the area will not be able to clear the infection as efficiently and can set up for chronic infection. A analogy would be thinking about someone with a diabetic foot. They've got poor circulation to their toes, and they get a little infection in their toe, and before you know it, it really can spread because they don't have good blood flow to that foot. So the same thing can happen in the bladder. You have to have good blood flow to have a healthy microenvironment. And estrogen helps those build up those little blood vessels. So I'm a big proponent for looking at hormones, whether we replace them systemically or we just do vaginal estrogen, and that will get absorbed locally into the bladder is very important. So hormonal optimization, I think, is key to look at for recurrent urinary tract infection. The other thing that I've started looking at with my patients is micronutrients, and we do advanced micronutrient testing where we can draw the blood and look at literally dozens of different micronutrients, minerals, and vitamins that we need to allow our cells to function optimally. And these micronutrient tests don't just look at, draw the blood right now and look at how much vitamin D, how much vitamin B12 is in your blood. I mean, those are somewhat valuable tests, but they're more looking at what has been accumulating in the body over the last few months. So you really get a sense of the stores of the vitamins and minerals that are actually in the cells. So they take a sample of the white blood cells and they have a process whereby the lab can measure the values of nutrients in those cells. And so we can get a picture of which nutrients are missing. Inside each cell, there's two main cell cycles that are very important. One is the ATP cycle, and that's the cycle by which the cell makes energy. So if the cell doesn't have the right micronutrients, then you can feed that cell all you want and your output of energy is going to be really low. The other one that's really important in recurrent urinary tract infection is the detox cycle. So how well is that cell doing at cleaning itself up, cleaning up its DNA, cleaning out any waste products? Does it have the supportive micronutrients to be able to efficiently do a cleanup job? And so doing this micronutrient testing can really help to get to the bottom of that. There are also several other inflammatory markers that I've been looking at, and the research is still very new in these areas. So I want to be clear that this is still very experimental, and I can't say that for sure this is going to solve recurrent urinary tract infections. But I think for patients that are sort of at the end of their rope, where they've tried the traditional things, they've tried, chronic antibiotics, they've tried taking the D-mannose and cranberry supplements and all the healthy things that they can do, I think it's worthwhile to look at these. And some of these markers are homocysteine, apolipoprotein B, lipo-A, various inflammatory markers, fasting insulin, to look at how the body is dealing with inflammation and see where we can have an opportunity to help the body to heal itself better, how we can support the body. The body is designed to heal itself. Think about when you're a kid and you would stick in your knee and your knee would heal right up. If it's not healing itself, there's something out of whack, something's not working right, something's missing. And sometimes we can really get to find what is going on in that area and what we can do, what we can add to or optimize to help the body heal itself better. What has gone missing? What are we missing from our diet, from our hormones? What has gone awry where the bladder is not healing itself, and how can we optimize that? The other thing that I'm looking at with my patients is looking for food sensitivities. So, I think there's been a lot of good data coming out lately about how what's going on in the gut can affect the whole body. And I used to be really skeptical about this, but the more research that comes out, the more compelling it is. And it makes a lot of logical sense too. If we're putting in junky food or food that our particular body is sensitive to, and that is creating an inflammatory cycle, it's compromising the function of our body, the function of our immune system, and making it very difficult for our immune system to work properly. So there's a blood test where we can look at what foods that the individual is sensitive to. And it may be some things that they are eating every day. It may be some things that are rare in their diet. But we can find if there's something that they can change with their diet to help decrease the inflammation in their body, with that inflammatory cascade that impairs the ability of the cells to function normally. So that's something very important to look at as well. I've also got some technologies in my office that can help patients build up their vaginal walls more quickly, that have really helped tremendously with my patients with recurrent urinary tract infections. Unfortunately, they're not covered by insurance, so they're pretty pricey technologies. And I wish that they were available for everyone, but the Mona Lisa Touch, the carbon dioxide laser, is very, very powerful for treating the vaginal wall, for helping to resurface it, and it literally will stimulate the cells to repair the vaginal wall, thicken it up, and bring in good blood flow, and that will straighten out the natural flora of the vagina. It'll improve the pH and improve the natural microbiome that's present in the vagina, so that the bacteria that cause infection are less prominent. And I've treated that with several patients, many patients actually, that have had a great result with that and noticed a huge difference. There's also a radiofrequency treatment. If someone can't tolerate the laser for some reason, there's a radiofrequency treatment, again, that is treated directly on the vagina to help treat these recurrent urinary tract infections. So it's these advanced treatments are not necessarily for everyone, but for someone that's really, kind of at the end of their rope, we can look at these things and see if we can find some underlying cause, some creative solution for recurrent urinary tract infections other than more antibiotics. And I do want to also point out that this would be after doing a complete urological evaluation. Someone that's having recurrent urinary tract infections, we do need to look at their kidneys. We need to make sure there's not a kidney stone or some sort of blockage in the urinary tract that's harboring infection, and do a bladder scope, which is a quick office procedure to make sure there's not a bladder tumor. I've seen that before, causing recurrent urinary tract infection, or some other abnormalities, some cysts in the bladder, that could be contributing to UTI. And I do want to point out that I have treated cystitis cystica and trigonitis in the bladder by cauterizing that area surgically, and have seen that help patients to clear up UTIs. So while these are still considered experimental, they may be very helpful for patients, and I think that it's worth a look. All right, I hope that was helpful. I hope you'll subscribe to my channel, and that you'll see me next time. Ask me any questions. Have a good one.